Minimally invasive transforaminal lumbar interbody fusion basically means lumbar fusion. However, when we do this type of fusion procedure, we do it minimally invasive, which means through small incisions. Back many years ago, when the procedure was first developed, we had to make a very large incision in the back. Now, with the new technology that has come to the forefront of spinal surgery, we are able to make very small incisions using very specialized instruments to remove the disc in its entirety, or at least the majority of the disc, replace that with various types of cages. For example, one cage is a very hard plastic matrix that we put bone graft into, and that we use as a device to restore the normal height of the disc. Another type of cage is titanium, which we also fill with bone graft. And another type of cage that we can use is a combination of the two, or an expandable cage where we can actually increase the disc space height by increasing the height of the cage when we put it inside of the disc. When we put a cage into the lumbar spine, it's necessary to supplement this with screws and rods. As an example, this is a lumbar spine where we have screws into the vertebral body, and these screws are connected with a rod here. And this is an example of a peak, what we call a peak cage. It is a synthetic plastic, and this is filled with bone graft, and we allow this to fuse over time. This is why we put in the hardware, or the instrumentation, is to help that fuse. And it takes approximately 6 months for this procedure for the spine to fuse.